Hi, I'm Dr. Christine DiEdwardo, plastic surgeon here at Christine Hamori Cosmetic Surgery and Skin Spa. We are excited to talk today about the RHA Collection, a new filler line we just brought into our practice over the last year. RHA filler is a new hyaluronic acid product that is available and FDA approved for dynamic lines and wrinkles. We brought this filler to our practice because it is different than some of the other fillers we've been using, which are very much used for facial shaping and volumizing areas with volume loss. This filler has specific indication to address fine lines and wrinkles which are caused by the dynamic motion of our face. So in our cheeks, the linear lines we get when we smile, which become more permanent as we age, or in the perioral area, the lines on the lip, the lines in the nasolabial fold and marionette lines as well. The RHA products differ from other hyaluronic acid products because it's specifically indicated for fine lines and wrinkles that are caused by dynamic motion of our face, particularly in the lower cheek and the perioral area. Specifically, the fine lines of the upper lip can be treated with the Redensity product, which when placed looks very natural and softens those lines without creating a puffy or volumized look. The other nice thing about this product is that it lasts for up to 1 year. So there are 4 different products in this RHA collection. All have slightly different molecular formulation to treat different aspects of the aging process. Some of the products can be used to treat deeper folds or bring volume into the cheek area, and that would be the RHA 4 product. There's an RHA 3 product that can be used for deeper folds or wrinkles anywhere in the face. The RHA 2 product might be used in a patient with thinner skin and finer lines and wrinkles, particularly on the mouth or in the cheek areas. And then the Redensity product is known for treating lines on the upper lip or lower lip, and is very light and pliable. As we age, several things occur. We lose volume in the fat pads in our face, which cause the soft tissue to descend, and we develop a heaviness along the jawline and in the nasolabial fold area. We also lose volume and collagen in the dermis of our skin, which results in fine lines, particularly in the cheek area. We see the radial lines, also the upper lip lines, lines on the lower eyelid, and together this causes a more aged appearance of the face. All of these factors determine what products can be used in different areas in each individual patient. When a patient comes in for a consultation, we look at the face as if it's a 3-dimensional puzzle. The patient's anatomy and goals dictate which products are used in each individual area. So if a patient has more volume loss in the skin with fine lines and wrinkles in the cheek, a product like an RH3 or an RH2 might be used, whereas they have deep folds in the marionette lines or nasolabial folds areas, a heavier product such as RH4 might be used to address their concerns. The products last up to 15 months, and in addition to providing softness of the fine lines and wrinkles, after the products integrate into the skin, they do give you that hydrating property that our normal hyaluronic acid would give us in our skin, making the skin look a little smoother and well hydrated. This is a gentleman who presented with complaints of volume loss in his cheeks and heaviness along the jawline. He also didn't like the downward turning of the corners of his mouth with the deep creases there. As you can see, the changes that occurred in his face resulted in a more rectangular shape with volume loss in the cheek areas and more heaviness along the jawline. After he was injected with RHA4 product in the cheek areas and the RH3 product in the marionette line areas, you can see that his facial shape has changed from a rectangle with heaviness along the jawline to a more rounded shape with the face with more fullness in the cheek areas and a smoother, softer looking jawline. He also has lost those deep creases near the corners of the mouth, softening that area. He was very happy because the results look very natural and it achieved his goals. The injections on this gentleman were performed in one session and he had very minimal downtime. Because I used a cannula, he had minimal bruising. This patient presented with deep marionette lines that bothered her. We developed a plan for her where I used the RH3 product in this area to soften those deep folds. This was performed in one session, and the patient had minimal downtime. Thank you so much for joining us tonight for our virtual event about our RHA product line. Please feel free to ask all of your questions for our live Q&A session. Type your question in the text box and we will be glad to answer your questions.
Hi everyone, it's Dr. DiEdwardo and me, Christine Hamori, here to talk to you about our new products, the RHA line. We're very excited, and you saw our little video that Dr. D made for us, and we're just wondering if you guys have any questions that you'd like to learn more about the product. We love it. We've been using it for several months and have had wonderful results on areas like lip lines and cheeks, and what do you think? What do you think it does differently?
Yeah, it's this product line is really special because it's the first hyaluronic acid line that's really been made and designed for dynamic lines and wrinkles. So those lines that occur when we're animating, it's very stretchable, so it doesn't look puffy or overfilled, and it looks extremely natural, which all of our patients are looking for a very natural look. So we really had
and we even saw one today. We saw a patient that had some other filler in by someone else a couple years ago and had some really full cheeks. So when she smiled, she saw bunching around her eyes. And we were like, well, if we dissolve that filler and we'll use our RH4, we can fix the problem, because you don't have the trouble with bunching with these products. It just is made to be put right under the skin. So when you animate and smile, it doesn't bunch.
Right.
It's good. All right. Maybe we'll look at a couple questions.
Okay.
Is there something?
So
okay.
you want to start? We'll start up here.
Yeah.
Okay. So is this something that can be used under the eye area?
Not on label yet, meaning that FDA hasn't specifically reviewed that area with this product, but I think I've been using it there. It's been working pretty well. The Redensity product, which is the one that's really kind of thin and just, you put it into little wrinkles right under the skin. It pops up the lip wrinkles really well, and it looks really good.
Great. I'm concerned about the bruising caused by the needles in my face. I bruise easily. Well, that's common. That there are many people out there that bruise very easily, and some things that we do to help reduce bruising during these injectables are taking. You can take bromelain or arnica montana prior to your injection. Sometimes I tell my patients they can eat fresh pineapple, which has bromelain in it. And then at the time of the procedure, we can ice that will reduce the little vessels in the area that we're injecting. And we also quite often use cannulas, which are blunt needles. So they result in much less bruising than when we use the needle for injection.
Yeah. And sometimes we, even for our patients that bruise a lot, we sometimes do a complementary light treatment with intense pulse light to kind of shatter the bruising. And over 2 to 3 days, it's gone completely. There is an option.
Okay, how much is very little downtime?
That's a good question. I guess it depends on where you're getting treated. Usual downtime, you're going to see some, let's say you're doing the cheek, you're going to see some swelling for 2 days. You might see where the needle went in the skin. You might get a tiny bruise there, depending if you're an easy bruiser or not, but something you could cover easily with makeup. I think you'd be able to go out that night, no trouble, but you might need a little makeup if you cover the bruise.
Right. I think certain areas also bruise more than others. I think the lip bruises a little more. The upper lip sometimes will bruise a little bit more readily than the cheek area. And in the marionette line area now, I quite often, almost always use a cannula to reduce the bruising there. So, but everybody's different. So, but this isn't the type of procedure you want to have during the week before you have a big event on the weekend. You want to give yourself a good, 10 days or so.
In case you bruise a lot.
Okay.
Can this treat the lower neck and throat area? Good question. That's a very tough area, the chicken neck. It's not going to help tighten skin. Maybe it could be used in some fine etched in lines. Again, we'd use the thinnest product possible that would stretch the most and maybe not show underneath the skin. It's definitely not FDA approved for those areas because the neck skin is a little different than the rest of our face. So probably energy-based devices might work better in that area.
Exactly right. I agree with that. What about the cost? I think the cost really varies from patient to patient because it all depends on what your treatment plan is. Everyone has different goals for what they're looking for, and if you're treating one area, that's much different than if you're treating multiple different areas on the face. So the best way to understand kind of what your treatment plan would be and how much of the filler you would need is to have an individualized consultation where Dr. Hamori and I we look at your anatomy. We spend a lot of time learning what your goals are, and then we develop a plan together to achieve those goals.
Yeah. I mean, I think that, it's hard to say. They start about at $750 per syringe, which let's say would help lip lines and maybe a little marionette line, depending how bad they are. If you needed cheeks, you're talking, you're going more north of that. It's more expensive because you need bigger volumes to do places that are on both sides of your face.
Okay. Do you numb prior to treatment? Yes, we do.
Yep, that's important. Icing, and we use topical creams. We have distracting little vibrating wands. We have Pronox, nitrous oxide if you want that. We have a lot of stuff to make it comfortable.
Okay. If I have a special event, how far in advance?
Should I make by appointment?
Yeah.
Depends if you're an easy bruiser or not. If you're not one that bruises too much, you could take the risk to maybe do it within, 3 days, 4 days. If you're someone that bruises easily, you want to give yourself more time because you want to have time for that light treatment. You want to have taken the arnica,
right.
Things like that.
Right. And sometimes I find that these products also, they're hydrophilic, so they absorb a lot of water. Mm-hmm. So I find that even at the second week and the third week, they look even more natural than even the first week. So you see the results right away, but I think they look even better over the next 2 to 3 weeks. So
with time as it integrates into your skin.
And then do we treat and consult the same day?
Yes, of course. Yeah. A lot of people come in to learn about what they need, and we can talk about different spots of the face, and we have a lot of other things that we do here from non-surgical to surgical, and sometimes we combine the two together. But RHA is we're really excited about what it can do. It can treat areas that we couldn't treat before. A little in the tear trough, the fine lines, the cheeks, the chin, giving some more volume in areas you wouldn't even think of. So it's super important to come in and let us evaluate your face to see what works best.
Mm-hmm. Oh, here's another one.
Okay.
Can
you use the product above brows to raise the eyelids, I must say.
Oh, to raise.
Again, an off-label use. We prefer probably to use a neuromodulator like, a Botox, Dysport, to raise those brows up mechanically with those products, but you do lose volume, I think, behind your brow as you age. There's a little fat pad that droops, and some of the more stiff products in the RHA line might be really good for that.
Yeah. And just when bringing up neurotoxins, we're very excited because we are getting Daxify in December. We're going to be one of the first offices in the state and also in the country to bring this new neurotoxin to market. It's FDA approved, And the nice thing about this neurotoxin is the duration is about double the duration of the current neurotoxin. So we're very excited to bring that into our
Yeah,
practice.
you're talking about 6 months worth of Botox, even 9 months in some of the studies. So it's amazing. And we're one of the few practices in the country that's going to be using this product, or able to use this product in December. And we can't wait to use it together with our RHA, and it'll be exciting.
If I used Juvederm in the past, is it okay to use RHA for my next treatment on my marionette line areas?
Yes,
Yeah.
absolutely.
How long does it last?
Well, some of them more than a year.
Yeah, exactly right.
Yeah.
Okay, if you need 2 of the RHA fillers, do you have to use 2 entire vials, or can the product be halved? I don't want too much either, but probably could use a little both. Okay.
I want too much of either, but probably could use a little bit of both, i.e. cheek filler and upper lip line softener. Is there one type of RHA that can do both? Well, they're very specific products. So the products are made from stiffer product that lifts things more effectively, and very thin liquidy products that would fill little tiny lines like etching and spackle lines. So probably if we're trying to treat lip lines and you want to have cheek filler, it wouldn't be good to use the same syringe. We want to use an RHA4 and a Redensity instead of trying to use one or the other, use the one for both. But you have a lot of lines. If you have a lot of lines in your lip, you probably have little forehead lines that we could etch it all into to use the syringe. We wouldn't throw it out by any means if we wanted to use up what you had.
Right. I had a blepharoplasty. I have wrinkles above my eyelids. Can it be used there? I worry about drooping. I wouldn't use it in that location.
It depends if you mean the lines are on your eyelid or above your eye.
right.
It's difficult in the question, but
Right. I'm thinking that the person saying eyelids, I wouldn't use it on the eyelid. But sometimes we do use hyaluronic acids for the lines on the forehead. They very much soften the forehead. And the nice thing also about this line is that it really hydrates. It absorbs water, and it's used very superficially in the dermis, unlike some of the other HA fillers we use. So it is very, very good for those fine lines and wrinkles in the skin, because it becomes very superficial.
so the other fillers, there's so many other fillers out there. They're both basically the same thing, hyaluronic acids, which are those sugar molecules that are in our bodies. So the RHA is a little bit different because it's more like natural collagen, because it doesn't have as much of what's called BDDE, which is a binding product that makes it last longer. The engineers and chemists have come up with a different formulation that's more similar to natural collagen in your skin that helps the hyaluronic acid be very able to move well, yet stiff enough to hold. So it is different, has different what we call rheology. It's different how it responds to your skin. So that's why we're finding a lot of different uses for it in solving problems like lip lines that we didn't have before, because the other products couldn't do that. Oh, she says above the eyebrow. That's
Above the eyebrow, yes.
Yeah. Yeah, so above the eyebrow is tough sometimes, because if you do neuromodulator, Botox, Dysport, you tend to drop your brow. So some people want filler in those lines. And yes, we could pick one of the RHA fillers that would probably work well in those eyelid, forehead wrinkles. But you still might want to combine it with some low-dose neuromodulator.
Okay. If you don't like it, can it be dissolved? Yes, it can be. Yes, we can inject something to dissolve hyaluronic acid products. I don't bruise with Juvederm, but do bruise with Sculptra. Do you think I would bruise with RHA? So it all depends. Sculptra is a different type of injection where we have to take that. We inject. Sculptra is something called poly-L-lactic acid. It's a molecule that we dissolve in water, and we inject diffusely in the skin to stimulate collagen production. It helps a little bit with giving volume to patients who have diffuse volume loss. It also helps the skin. The hyaluronic acid products are used for different purposes than that. So they're not, it's a different injection technique and at different locations. So I would say most patients don't bruise as much with the RHA or hyaluronic acid products as they do with a product like Sculptra, due to the way that the areas and the way we inject the product.
And the needle sometimes is a little bit larger in the Sculptra. And the Sculptra we're usually putting all over the face, where with these other injectables, we're kind of targeting in a little line or a little fold. But Juvederm, you probably would bruise about the same you might with Juvederm.
Right.
It's more similar to that than Sculptra.
Right.
You can sleep with pillows after
treatment, like I don't think you need to sleep on pillows after treatment.
What else?
Waiting for any other questions.
Yeah. Yep. Okay. So if we have no more questions, we're going to wrap things up. And thank you for